So let's take a look at a few clinical teaching strategies. As I said before, actions do speak a lot louder than words. So do as I do, not do as I say. One of the most effective clinical teaching techniques is consistently modeling the behavior or skills that are being asked of the student. If you want your student to act professionally, then you should be professional. If you want them to be confident, competent, and have a good skill set, then you should demonstrate that for them. When the instructor demonstrates the professionalism, technical aptitude, and leadership that are expected, a student learns by observing and emulating that behavior. And this is one of the very best things that you can do for your student, is to show them what is expected of them. Ask questions. Slow down to give them time to consider their answers. Have them compare actual experience with the theoretical expectations. Let them ask you questions. Have them provide alternative solutions. So talk about your calls afterwards. Is there anything they would have done differently, or anything that you would have done differently if they were taking the lead? Have them predict and anticipate changes in the patient condition in response to treatment. And I really like to do this. So I'll talk to my patient and let them know, if it's not a life-threatening situation and they can, understand why I'm doing what I'm doing, then I'll let them know, hey, this is my student and this is why we're going to be discussing. So I'm not trying to talk over you, but just understanding where the conversation is going. And then I'll ask the student about, medications. Are they a candidate for this? How much would you give? Why would you or would you not? Is there anything you want to do? Should we do anything? What do you think will happen if you give that fluid bolus or medication? Just to talk about things that could potentially happen, because again, this is a very small window of time that they have to learn from you and be able to have the safety net of making mistakes in their clinical experience. Avoid any yes or no questions, just as if you were assessing a patient or interviewing a patient. Let it be open-ended. Get their feelings, their thoughts. Have them open up to you. Build that relationship. And then when we talk about pairing students with preceptors, so we talked about limiting the number, having multiple preceptors versus having just a few. So luck of the draw method of pairing students and preceptors can be inconsistent at best and may result in poor educational experiences. And like I said, that's kind of how my preceptor time was when I was in paramedic school, and I'm sure most of you, it may have been the same way if you've been practicing for a while. Then having multiple preceptors can make consistent and accurate feedback difficult to obtain. Having one or two preceptors can allow that trust to be built and a student to become competent more effectively. Preceptors should be objective and fair, even if they have previous working relationships with the student. Any case in which a personal relationship between a student and their preceptor is already present should be avoided at all costs. So if they already, not if they know who they are, but if they already have some type of personal relationship outside of work, definitely should not have them paired together. Pairing a student with the right preceptor can be challenging. Ideally, these pairings should be thoughtful, deliberate, and well coordinated, and consider teaching and learning styles as well as personalities. And so for EMTs, and in the very beginning of the paramedic class, Mark puts a lot of effort into that, a lot of thought into that when he's pairing students up to preceptors. But when it comes down to the capstone phase, we expect the student to choose their own, one or two preceptors that they want to stick with through that capstone phase. By then, they know who they're comfortable with. They know who they want to emulate, who they, see as their mentor. And so it's really important to them to have those relationships and be able to stick consistently with those people. And then documentation. This is a big part of being a preceptor. Again, we mentioned you should document both the success and the failure of the student. Preceptors should document a student's growth in skill level and also in confidence. We talked about the affective domain and how difficult that can be to measure. And this is one of the ways that we can. You seeing this student day in and day out, riding on the truck with you consistently, measuring their performance, seeing them in the field, seeing how they emotionally respond to calls is one of the only ways to assess that affective domain. Preceptors should openly debrief each call with the student and ask what could have been done differently or better in addition to what went well. And this again will create a plan for the next call or shift. We try to have a rule of thumb with our students here on campus that we want to end on a positive note. So we usually address things that could have been done better first. And I don't ever want to say negative or, things that you did wrong, but things that could have been done better. And then we'll end on what went well so that the student always leaves you on a positive note. Preceptors should be monitoring all aspects of the student's performance, study habits, patient interaction, treatment plan, and execution, as well as their documentation. So that means you should be reading their call reports. You should be reading what they're writing about these patients, whether you use an electronic system like we do, like Platinum Planner, or whether it's pencil and paper or something like FISDAP, whatever it is, you should really be reading all the way to the end of that. See that student's thought process. Make sure you weren't just assuming based off of their actions that they thought a particular treatment plan was right for this patient, but understanding, what they put on paper. And that's it for the clinical piece here that we're going to talk about. So I will catch you guys in the next PowerPoint, which is going to be talking about evaluation and remediation.